Good evening, everyone. I'm Dr. Simone Rofena. I'm the medical director here at the Zita West Clinic. And tonight I'm happy to talk to you about how we do IVF here at the Zita West Clinic. So I will run through a short presentation about our approach to IVF at our clinic, and then I will leave plenty of time for you to ask any questions you might have. So we could start our presentation by telling you basically what is the holistic approach, which we are very proud to have introduced in the UK. We were the first clinic in the UK using this approach, and since then, now a lot of clinics have done the same because they have recognized the validity of this approach. So what is the holistic approach? The holistic approach is basically integrating not only the medical part, but paying attention basically to other aspects, like, for example, nutrition, which is of paramount importance in improving the quality of the eggs and the sperm, which we use to create embryos. But not only that, also we have set up an approach which include a multidisciplinary intervention with some specialists like acupuncturist, hypnotherapy, counselors, which make sure that the couple is actually supported also from different points of view, which are equally important, if not even more important, than just the medical part. Because, and I've seen this many times, the medical part alone will not work if actually the couple, and particularly the woman undergoing the treatment, doesn't feel in the right place. So that is what the holistic approach is about, and I'm proud to say that we were the first, as I said before, to look into that. So just continuing with the presentation, we can just now get more into briefly what is the IVF process. The IVF process entails a first part where basically we stimulate the ovaries to create basically the eggs. Then we extract these eggs and we fertilize them together with the sperm to create as many embryos as possible, and then the best embryos are then selected and transferred into the uterus. So moving on with so why the IVF still doesn't work in unfortunately most of the times, because IVF is a relative inefficient process, we have to say. Best case scenario in younger patients, we achieve around 50% of success per embryo transferred. That is the best a clinic can normally do. And there is a reason for that. The reason is that depending on the age of the couple, and particularly of the maternal age, there is a high incidence of genetic abnormalities in the embryos, which you can clearly see in this picture, which describes the decline in the genetic viability of the embryos according to the maternal age. And you can easily see by yourself, by looking at the picture, how basically after the age of 44, the likelihood to find a genetically viable embryo reduces quite significantly. That explains why, even with the best efforts, IVF remains a relatively inefficient procedure. Although, having said that, we can still achieve a more than decent rate of success, particularly if things are done in the right way, which is very much, the scope of this presentation, to tell you how things should be done correctly. So moving on, we can analyze basically what can be the main issues and the main things to be identified. So clearly the uterus is very important, because the uterus is the recipient of an embryo. So we need to make sure, and this is normally done at the first consultation, or when the first scan is done, to identify whether there are any anatomical problems in the uterus, any polyps, any fibroids, which might make more difficult for an embryo to implant. So there are also other factors apart from the uterus, which we can see in the next slide. Sometimes everything looks fine. So the uterus looks fine, the embryo is of good quality, but we still have patients repeatedly failing or repeatedly having miscarriages. And that's when it might be worth looking at things like autoimmunity and thrombophilia, because these are two factors that can sometimes increase the chances for a treatment to fail, so for an embryo to fail to implant, or for the pregnancy not to be able to continue successfully. The thrombophilia is an increased risk basically for blood clotting. It is mostly genetically determined, in the sense that there are some genetic factors that can be identified through some test. There is a set of tests for thrombophilia, which is normally requested in case of more than one miscarriage for unexplained reasons. Whereas autoimmunity is a bit more controversial, because it's not universally accepted as a concept. There is still some controversy about how the immune system might actually cause potentially a problem, and also there is a controversy on how to possibly detect that. So what test to potentially run, and there is even a controversy on what is the best treatment, assuming that we are able to identify that. So it still remains quite a controversial aspect of our field. We normally run some tests at our clinic when we think that there might be a chance that the immune system might actually cause some problems, and when we identify some of the factors that can cause a problem, we normally recommend a treatment to induce a better toleration from the immune system to the embryo, basically. So moving on with other possible reasons for a failure, there is this interesting concept of uterine receptivity. And there is a test which was developed from the EV group in Valencia, which is called ERA, which is now quite popular, and is now offered together with two other tests, one called EMMA and one called ALICE. So there is now a test which can do the three of them with the same procedure, which is basically a uterine sampling through biopsy. And with this test, we can identify some interesting things. So, for example, whether the time we are putting an embryo in is a good time for the patient we have in front of us. Because according to the EV group who has developed this test, up to 30% of patients might actually have a different window of implantation. So that would imply that by the time we are putting an embryo back, the uterus might not be in a receptive state to accept this embryo. So in this case, we should delay or anticipate the transfer according to what the test would suggest. And the EMMA instead looks at the uterine microbiome. So whether this is a concept that has been recently developed and is now gaining more and more importance, according to which also the presence of the so-called good bacteria, so the lactobacillus, similarly to what happens in other areas, particularly in the gut, should be quite important for a healthy implantation of the embryo. And the same is valid for the presence of an infection or an inflammation, which can be detected with the ALICE test. So as I said before, now these three tests can be offered at the same time with the same procedure. So moving on to I've just described basically what is known, but there is still quite a good part which is estimated to be in at least 15 to 20% of all failed cycles, which for which we don't have a reason. And we have to acknowledge that, we don't have all the answers. We don't know in 100% of cases why a treatment is failing, or why our patients are not getting pregnant. So we need to acknowledge our limits, and we need to know that we don't always can provide an answer to our patients in regards to why their treatment has failed. So moving on to what so where the research is actually going towards. So there are some very interesting areas that actually have been explored to extend, for example, the reproductive age further. And for example, someone has thought about freezing the ovarian tissue when a woman is still able to produce eggs, and then eventually reimplanting this tissue once the woman has exhausted her reproductive function. And this is one of the promising areas research is looking into. And also a lot has been researched into why, even if an embryo is genetically viable, why still the embryo doesn't implant? Because we have now a way to determine whether an embryo is genetically viable or not through the genetic testing. But still, this doesn't guarantee 100% of success. So there might be other aspects that determine an embryo to implant to be viable, which are not only genetic, and they are not testable at the moment with the test we have available. So things like the energy of the embryo through the two structure called the mitochondria, for example, have been taken into consideration, and this is supposed the energetic function of the embryo is supposed to go down, unfortunately, with the age of the patient, and that has been claimed as one of the possible reasons as to why even good embryos, even genetically viable embryos, might not work sometimes, because their energetic structure actually is not supporting the implantation process. And also, the research is trying to look into less invasive methods for testing an embryo genetically, because the actual methods we have available are quite invasive. That entails actually removing a few cells from each embryo to gather a genetic diagnosis. But that process, which is actually a biopsy of the embryos, is quite intrusive for the embryos. We are removing cells from the embryos, and we know that the embryo doesn't like that. So actually, in some cases, this might also produce a damage to the embryo, which might result in the embryo actually not implanting, even if it's genetically viable. So we are still far from having the perfect method even to test the embryos genetically, and that's why the research is now looking into some less invasive methods. And I think we have made good progresses in the last few years, and we might be very close to find hopefully less invasive methods to test our embryos genetically. So as I said in my introduction, I think it's not just about medical procedures, not just about protocols, medications. the emotional support is vital for our patient, and that is why a caring team, not just doctors, but I mean the whole team, nurses, admin, makes makes a huge difference to the couple experience, and makes a huge difference also in the outcome. We see it every day. If a couple feels supported throughout their journey, the outcome is inevitably better, because there are things that cannot be explained scientifically, but translate into our patients actually responding better, because there is a link uh, between mind and body, and we firmly believe in that, and we see this in our daily practice. So that's why we aim to support all our couples through counseling, to nutrition, to acupuncture, to hypnotherapy. So whatever it is needed to help our couple will be beneficial actually for the rest of the treatment, and for the final outcome. So yeah, I love to make the presentation short, because actually I think one of the most important thing of these events is to give the possibility to our patients to ask questions. So I'm now open. I officially open the question and answer session. So please feel encouraged. I know there are already some questions that have been logged in previously, so I shall start from these ones. So the first one is, does acupuncture increase IVF success? Well, probably one of our acupuncturists will be more suitable to answer this question, but I would say definitely yes, although the mechanism by which this might help might be different. In my opinion, one of the most efficient mechanisms by which acupuncture might help is at reducing stress levels. That's where I see a big value in acupuncture. So my answer is definitely yes to that. Another question is, if you have a low AMH, are 40 of age and used to drink and smoke, can I have a healthy baby? Well, I always say to my patient that the AMH is not determining the likelihood for a patient to have a healthy baby. The AMH is basically a measure of the quantity of the eggs, not the quality. Okay, the AMH cannot predict the quality. It's only a predictor of the quantity of eggs we might get. So again, the answer is yes. Even a patient with a low AMH, even at the age of 40, can have a healthy baby. I mean, clearly, alcohol and smoking and bad habits do not help at any age, because they might produce some damages in all the cells, including the eggs, and have an impact on the quality of the eggs. So and that's why one of the first things we do when we plan an IVF treatment is to include in the treatment a free of charge nutritional consultation. So one of our nutritionists takes care of giving all the recommendations in regards to diet, alcohol, coffee, supplements. So because the preparation is fundamental. But yes, even a woman at the age of 40 with a low AMH can get pregnant, and I've actually seen many in my experience who got pregnant even with a low AMH. What supplements are recommended throughout treatment? Well, again, we are lucky to have professionals taking care of this, because there is a huge variety of supplements. So we prefer to give professional advice through our nutritionists, because there is no one supplement uh, equal to another. So it's always good to run through what are the couple habits in terms of diet first, to identify which supplements might be more suitable in regards to the nutritional needs of that specific couple. Uh, then we have another question which is similar to what I just say. Should I change my diet for IVF? Well, most of the time, yes, unless a couple's diet is already perfect, which is hardly the case. So most of the time, some changes in the diet are recommended from our nutritionist in order to get a better quality of eggs and sperm. Then I've got, can you explain what happens during reproductive immunology? Uh, well, as I said, the mechanisms are still quite unclear and quite controversial, but basically the concept is that the immune system might not be tolerating, actually, for some reasons, the embryo. So the concept is that the immune system might trigger an immune response against the embryo, as if the embryo was basically an intruder, a foreign body. So what we do is to try to induce a modulation of the immune system through some medications, in order to reduce this mechanism of reaction against the embryo for the time that allows the embryo to implant and to initially develop, which is usually the first trimester. After that, the embryo, the pregnancy is actually strong enough to continue until the end. So the treatment is not necessary throughout the whole pregnancy, but the first trimester is the most important phase. Then we got another question. Can you know from standard semen analysis if we would require ICSI? Well, yes and no, because in some cases it is evident, particularly when there is a low count of the sperm or a very low morphology of the sperm. In that case, it's quite evident that that individual might need ICSI to have better chances to conceive. But in some other cases, there are some hidden problems. So, for example, it has been suggested that the problem could sometimes lie in the DNA of the sperm, which cannot be seen just from a standard semen analysis. So if the sperm has a high degree of DNA damage, then there is a specific test that needs to be done, not the standard semen analysis, to look into the DNA of the sperm. And eventually, if we can identify that the DNA of the sperm is highly fragmented, that could be an indication to do ICSI, even if the parameters of the sperm are actually all normal. Then I got a question which looks a bit funny. How old do you consider it to be too old? Well, that's a million dollar question. What can help the egg to have good quality? Is PGTA a must for a woman who older than 38 if the AMH is over 24? Well, there are a lot of questions in one question here, but I'll try to answer briefly. Well, I mean, as I said in my introduction, after the age of 44, unfortunately, the likelihood to find a viable embryo is very, very low. It's about 2-3%. And even in a woman of 42, 43, sometimes it's difficult to find viable embryos. But the age is not the only factor, although it's the most important, because it also depends on the capacity of a woman to produce still good quality eggs. And sometimes there are patients, even at 42, 43, who are still able to produce quite a lot of eggs. And by having a lot of eggs, we can still find the one we need to create a good embryo. So what can help the egg to have good quality? I've already hopefully explained that. So a good preparation, good diet, good supplements, good lifestyle, all these things help hugely. PGTA is never a must for anyone. It's something that needs to be discussed with the clinician to see whether the benefits might be more than the negatives, because, as I said before, it's not the magic wand and is not the perfect test. There are some advantages, but there are some disadvantages. So it's always a conversation with the clinician that will help the patient decide and will guide the couple as to whether it might be a good thing to be considered. Then we have a patient who asks, I have been told I have a high natural killer cells. Is this something you would treat? Yeah, well, this is one of the tests we run to see whether the immune system might actually play a role, although it's very controversial as to whether the natural killer cells might help or might be involved directly in these processes. But we actually use them in some cases to try to identify what could be the patients who might have this problem. So my answer to that would be yes. Do you recommend IUI to women over 42 years old if the preliminary test results of the patient, including ultrasound scanning, blood test, look normal? Well, I don't see a value of IUI, particularly in older women. So I wouldn't do an IUI in a woman over 42 years old, because actually the chances of success are risible. So I would rather discuss IVF if there is a space for IVF. Otherwise, basically, the chances are not different from trying naturally to having an IUI in a patient over 40. So I would not recommend IUI personally to a patient who is over 40. That's my personal opinion. Someone might disagree with that, but that's what I have seen in my experience. How long should I stop using retinal before starting IVF? Well, I don't use retinal, so I'm afraid I might not be the best person to answer this question. Moving on to the next one. How important is nutrition in the lead up to IVF for both the female and male? I've already said that is very, very important. How long should you prepare the body with acupuncture and nutrition prior to starting IVF? Well, I would say at least 2 months. That's what we recommend for both acupuncture and nutrition, at least. How important is FSH levels for IVF, and what is healthy range? FSH has now been, in my opinion, surpassed by other tests which are more reliable, like AMH, for example. So it's actually has lost importance, in my opinion. It's still good to understand whether a patient has entered menopause or pre-menopause, for example, because when we start having levels above 15 and particularly above 20, then we know that the likelihood of a patient to respond to the treatment might be very low unless the FSH goes down. So that's the use I give to FSH. But and a healthy range is anything below 9, I would say. When we start having more than 10, then it's still possible to achieve a pregnancy, but there might be more difficulties in the follicles responding appropriately to the stimulation. Moving on with the questions, we have got from the test results of egg reserve, can doctors predict how long a woman can continue to have a period? Is the stopping of period a signal that even IVF will not work? Well, normally fertility can stop even before the stop of periods. The stop of periods is called menopause. But fertility can finish. Menopause on average happens between around the age of 50 for a woman, sometimes a couple of years before, but fertility stops much earlier than that. So normally around 40, 44, maximum 45. So the two things do not coincide. The stops of the period doesn't mark the stops of fertility. The stops of fertility can occur several years earlier than that. But definitely when a patient stops having period, particularly for a long period of time, unless there are other reasons for that, it is something that has to be looked into quite seriously, because might not be a good sign. What is the solution for fluid in the endometrium lining? My cycle was cancelled in regards to that. Well, that is quite a big problem. I see quite a lot of these women, and normally most of these women have had cesarean section before, or a surgery to their uterus, for example, to remove fibroids. And that what happens is that the scar tissue of a previous C-section or of a previous surgery can actually be responsible from the production of this fluid, and clearly, if the fluid then gets inside the uterine cavity, that can be a big problem for affecting the embryo implantation. So if that tends to occur every time we are planning a treatment, then I normally recommend my patients to undergo a procedure, a surgical procedure, which can be either hysteroscopy, so coming from the uterus, or can be a laparoscopy, so coming through an incision in the belly button, depending on where we think the problem is. And in this respect, a scan or a magnetic resonance can help in identifying what could be the best approach, because the surgical treatment is normally the best thing to do to resolve the problem. So then we have got what looks the last question. If I was lucky and got multiple good quality embryos at 37, is my success still reduced if I implanted it into an older uterus? Well, I have to say no to this. The actual evidence is that the age at which the embryos were created is far more important than actually the age at which an embryo is transferred. So I would tell to this patient that her success is not reduced even if he implants the embryos at 40 plus of age, because what is more important is the age at which the embryos were created. So yeah, it seems that we have finished the questions. So yeah, so it was my pleasure to give these presentations to you this evening, and I hope you have found this interesting. And yeah, if you would like to have more information or to book a consultation at our clinic, feel free to get in touch with our clinic, and our staff will be more than happy to help you, whatever is your request. So I would like to thank you, all of you, for actually listening to this presentation, and yeah, look forward to seeing you again soon. Have a nice evening.